Hi, I'm going to demonstrate the Testopel insertion procedure, and we put first prep and drape the buttock, and this time I'm doing it on the left buttock, and take 10 cc's of local anesthetic with 2% Xylocan, and first raise a wheel, if you notice, and then in a fan-shaped manner, just go into the subcutaneous tissue and instill 5 cc's of Xylocan there. Then I come out and just at right angles to it, instill 5 more cc's in this tract also. Again, just going very at that, different levels, just so that then when I come out, I just raise another wheel. This is very important. And then I take a stab knife and then I put it in exactly to the depth that I need. I don't want too much. I want a small opening, enough for me to put this trocar in. If you notice, the thing is so small, the opening is so small that it's enough to just put the trocar in, okay? Then you go in right at 45 degrees to the subcutaneous tissue and then go parallel below the fat, when you reach below the fat. And then you take it out, and this is the slot where the pellets go in. I put a little gauze piece here to, if any pellets slide out or fall out, we don't lose them. So we can retrieve it. Okay, so that's something which, and gradually we put the pellets in one by one and slide it in. I put 6 in each track, a total of 12. And if you notice, we have gotten this track on. Then I take this plunger in and push it in. And here I rock it a little bit to make sure it comes out. So sometimes there's a little fat on the edge inside the trocar so that it doesn't come out. When I come out, we just make sure there's hardly any bleeding, actually no bleeding at all. So we are in the right track. Go back with the trocar again and do the same thing. Right angles to this. Go in there and go at right angles again. Make sure we are right parallel to it, not too superficial. That's what I'm making sure right now by feeling it, okay? And once I do that, then I take the trocar out again. Keep this thing still there. And then I just push it in. 1, 2, if you notice, it just, and then again, take the plunger. Again, rock it a little bit. Very important to rock it so that you get the whole thing in there. So sometimes it's a little difficult to come in. If you notice, everything is around there. There's hardly any bleeding. We don't have to close with sterility because the opening is so small. I put a tape on there, and this tape is very tight so that it gives some pressure. Another tape. And tightly give some pressure. Then I ask him to turn around and lie on this area, on the buttock, for about 5 to 10 minutes to give pressure in this area. He doesn't have any bleeding, but just in case, that helps prevent any hematoma. Turn around for me, please, okay?